High-risk medicines are those medicines that have a high risk of causing significant patient harm or death when used in error. High-alert medication is simply a drug that has an increased risk of causing injury if it is misused. All medications carry risk of adverse events if prescribed, administered, or dispensed inappropriately. So a distinctive procedure has to be followed by pharmacists while dispensing of high-risk medications. The various session objectives and take-home message are as follows. To recognize the appropriate procedure for dispensing of high-risk medication. To identify the various factors influencing dispensing error. To identify various risk reduction strategies so we can prevent dispensing error. Various case reviews that will give concepts on reducing errors while dispensing such medications. Pharmacists should follow a precise procedure while dispensing medications that possesses a high or elevated risk to patients. The procedure that have been followed by the pharmacist while dispensing high-risk medication is discussed in 4 steps as input and initial check, patient information, therapeutic check, preparation and labeling, supply and educate. Input and initial check. In dispensing a prescription, a pharmacist has to exercise an independent judgment to ensure the medicine is safe and appropriate for the patient, as well as that it conforms to the prescriber's requirements, such as name and signature of the prescriber, as well as patient's details such as age, weight, medical conditions, allergies. These helps in the appropriate selection of drugs to be dispensed. If there is any doubt, the prescriber is to be contacted. Conform medication and also indication of drug before dispensed. The high-risk medicaments should hand out only when it meets the prescription legal requirements, such as date, drug strength, instructions, and signature of the prescriber. Therapeutic check. Certify whether dosage is safe and appropriate based on age and weight, or any modification have to be done while allotting of high-alert medication. Confirm the medication is compatible with current medical conditions and allergy while allotting these medications, because some patients may have severe allergic reaction with certain drugs. Dispensing of such drugs may create a severe glitches. Confirm whether the medication is compatible with other medications being taken or not. Ensure the prescription is appropriate for the condition being treated. Preparation and labeling. After proper selection of medication, proper labeling has to be done. In some case, drugs have to be prepared before handout to the patient. For example, amoxicillin or clavulanate potassium or augmentin suspension, which is in powder form, have to be mixed with water to form a suspension. A pink sticker is used while labeling the high-risk medication. The label should be clearly and legibly printed in unambiguous and understandable English. Other languages that are accurate translations of the English may be used in addition to English. The label should be placed to leave visible any of the manufacturer's statements that may be important to the patient, including the expiry date, storage conditions, and wherever possible, the name and strength of the drug. Supply and educate. While dispensing high-risk medication, educate the patient or caregiver on the appropriate use of the medication, such as what is the use of the prescribed medications, at what time it should be taken, foods to be avoided while taking such medications so as to prevent drug-food interaction. In the case of patients taking repeated prescriptions, counseling provides the opportunity to inquire if the patient is taking the medicine correctly, if the medicine is having the desired outcome, or if there are unwanted effects. It offers a further opportunity to detect any errors. The contents of a CMI, Consumer Medicines Information leaflets, such as mention of certain diseases or side effects, may cause confusion or even alarm among some patients. Therefore, the pharmacist may need to work through the CMI with the patient in order to relate its contents to the individual circumstances. All high-risk medication stick with pink sticker are kept in highlighted pouch and then dispensed to the patient. Face-to-face counseling is the best way of communicating information about medicines, but where that is not possible or practicable, written information and/or a telephone call are recommended while making sure that the information is provided directly to the patient. A dispensing error is a discrepancy between a prescription and the medicine that the pharmacy delivers to the patient or distributes to the ward on the basis of this prescription, including the dispensing of a medicine with inferior pharmaceutical or informational quality. The various factors that most significantly influence the dispensing error of high-risk medication are patient information, drug information, communication of drug orders and other drug information, drug labeling, packaging and nomenclature, drug standardization, storage and distribution, staff competency and education, patient education, patient information. Information about the patient guides the appropriate selection of medication doses and route of administration. Of significant importance is basic demographic and clinical information. Example, age, weight, allergies, diagnosis and pregnancy status, as well as patient monitoring information. Example, laboratory values, vital signs and other parameters that gauge the effect of medication and patient underlying disease process. Studies have shown that as many as 18% of serious preventable adverse drugs events stem from pharmacists having insufficient information about the patient while dispensing the high-risk medication. Narcotics and antimicrobials are the two drugs categories most frequently involved in errors related to insufficient patient information. Most serious adverse effects are due to prescribing these drugs for patients allergic to them. Common contributing factors for patients' information-related errors are listed below. Absent or unclear patient identity, missing patient address, age or date of birth, especially if child under 6, not noted or taken into consideration. Weight unavailable or unit of measure are not indicated, or pounds versus kg for proper dosing calculation. Allergies unknown or not updated. The various risk reduction strategies for patient information's related errors are enumerated below. Routinely ask for patient diagnosis and comorbid condition, including pregnancy, and add this information to computerized patient profile. Annually update patient demographic information. Ask for 2 patient identifier when receiving telephonic prescription order. Obtain or validate patient weight when filling pediatric medication. This is a question on collecting patient information. Answer is D, as all these are the key pieces of patient information needed to properly screen a prescription for appropriateness and safety. Obtaining the patient's weight is crucial when filling pediatric prescriptions because most drugs are dose-based on weight. Also, having the knowledge of what the physician is treating will determine whether or not the dose is within the acceptable range. Comorbid conditions such as renal failure will also aid in determining the appropriateness of the dose. Drug information. Most of the adverse drug events were caused by combination of insufficient knowledge about usual drug doses with miscalculations or incorrect expression of measurements or drug concentrations. The pharmacist must have proper drugs informations. If the information regarding the drugs is to be dispensed is not known, then it should be discussed with senior pharmacist or consultant. Then only it should be dispensed. Here is a case review. Prescriber should use a suffix to differentiate a product only when this designation is linked to specific product and represent the FDA-approved name for the prescribed agent. When confronted with a non-standard and unrecognizable suffix, pharmacist should verify the intended product and dose with the prescriber. The figure shows the two different release products of morphine sulfate, which is a pure opioid agonist selective to the mu receptor, with primary actions in the brain through transitory stimulation prior to depression. In CNS, it promotes analgesia and respiratory depression. The uppermost is immediate release of morphine sulfate tablets, elimination, half-life 2 hours, while the lowermost is extended release morphine sulfate tablet, elimination half-life 11 to 13 hours. Both tablet strip look alike to each other, so double check should done while dispensing these type of medications. Here list the common contributing factors and suggested risk reduction strategies for drug information related errors. It is critical that the non-availability on any updates on the medication to the pharmacist, which can be overcome by regular continuous education program. Secondly, manual or computerized alerts may not be followed. This issue can be solved following labeling HAM and separating LASA drugs. Lastly, an independent check is required which require a thorough understand of the case. The answer is B, or false. Pharmacist should be proactive and review external source of medication safety information and LASA list more frequently than once a year, because risk will be increased with new drugs. If a new drug is dispensed, pharmacist should consider the potential for drug-drug interaction, duplication of therapy, and LASA name confusion. In addition, safety information should be reviewed and communicated to technicians. Communication of drug order and other drug information. Miscommunication between physician, pharmacist and nurses is a common cause of medication error. Failure to control and standardized prescribing vocabulary often leads to inappropriate use of dangerous abbreviation, acronyms, coined names, and other ambiguous methods of communicating drug information that can easily be misinterpreted. Medication error are due to the use of incorrect drug names, confusing expression of dosage forms, and misunderstood abbreviation. Mainly, the spoken order leads to patient harms. Spoken orders, fraught with danger of being misheard, are another method of communicating orders that is often misinterpreted. While spoken orders may be convenient to those prescribing medications, their use should be reserved for true emergency situations to minimize unnecessary obstacles to clear communication. While reducing telephone orders to writing, pharmacists should never abbreviate drug name or use dangerous abbreviations when transcribing the patient administration directions. Here is case review. A medication error has been reported in which the physician entered the first few letters of the drug name, that is MET, in the prescription, and the pharmacist dispensed metformin instead of metoprolol tartrate. After few days, the same patient gets admitted in the hospital and gets diagnosed with hypoglycemia with accelerated hypertension. The above diagram shows the two different drugs products. The uppermost is metformin hydrochloride tablets, which is an anti-hyperglycemic agent that improves glucose tolerance in patients with type 2 diabetes, lowering both basal and postprandial plasma glucose by decreasing hepatic glucose production and intestinal absorption, and improving insulin sensitivity by increasing peripheral glucose uptake and utilization. The lowermost is metoprolol tartrate, which is a beta-adrenergic blocker with selective activity on beta-1 adrenoceptors located mainly in cardiac muscles. At higher dose, it may inhibit beta-2 adrenoceptors of bronchial and vascular smooth muscles. The several risk reduction strategies related to communication of drug order and other drug information related errors are listed in this slide. Drug labeling, packaging and nomenclature. High alert drugs should be properly labeled and packaged, so it will be easy while dispensing the drugs. While dispensing these drugs has to be individually labeled with pink sticker and has to be individually packed in unit dose dispensing system. All the labeled and packed drugs are kept in the colored pouch while dispensed. Especially, the LASA drugs should be handled properly. Case review. The two formulations of Byetta are distributed in pen injector, one delivering 5 microgram per injection and one delivering 10 microgram per injection. The wrong strength may be dispensed because both pen have similar NDC numbers. The middle 4 number, which usually represent the distinct drug product, are actually same for both strength of Byetta pen. Only the final 2 digits of NDC number are different, which may not be read by certain barcode scanning programs. The figure shows Byetta injection 5 microgram and 10 microgram respectively. Both the injection are similar to each other, so the chances of having dispensing error is more. Byetta contains exenatide, which is a GLP receptor agonist that enhances glucose-dependent insulin secretion by the pancreatic beta cell, suppresses inappropriately elevated glucagon secretion, and slows gastric emptying. The answer is C. Although prescribers often speak much faster than one can write, it is important to avoid using error phone abbreviations and dose designations. In many pharmacies, the hard copy of prescription is scanned into the pharmacy computer system. This image is then used during final verifications. Error-prone abbreviations used on the prescription can be misinterpreted by a different pharmacist, which may result in error. Therefore, it is important not to use abbreviation and clearly write out complete drug names and directions for use. The answer is D. Perhaps there is better lighting in the fast rack section, but these two drugs could potentially still be next to each others on the shelf. By physically separating the two medications, this will help to reduce the contributing factor for errors. Drug standardizations and storage. High alert medication are accessible to patient and are dispensed in safe and secure manner. These medications are stored, dispensed and returned to stock in a manner that reduces the likelihood of an error. All areas of storage, including shelves, refrigerators, narcotic safes and will call bins, should be of adequate size to avoid clutter. Recommendations include having separate glass front refrigerators for stock and filled prescription and narcotic safes or cabinets that are of adequate size to meet the needs of particular pharmacy. Both refrigerators and safes should have shelf dividers or baskets that allow for well-spaced stock that can easily be seen. Never allow employees to store food in any refrigerator used to store medicine. Each pharmacy should develop a process to regularly review stock for short-dated products that need to remove from active inventory. Expired, returned and recalled medications waiting return to wholesaler or manufacturer need to be stored in areas clearly differentiated from regular stock. Here is a case review. An error that was reported in which methylphenidate 5 mg was dispensed instead of oxycodone 5 mg. The error was due to look-alike container labels from the same manufacturers being misread. In addition to this, both drugs are scheduled to and stored next to each other in the crowded narcotic cabinet. The staff had put the strength of the tablet on the top of the vial container for easier retrieval. In this case, both stock bottles had the number 5 handwritten on them. The above picture shows the tablet's strip of oxycodone hydrochloride on left and methylphenidate on right side. Both container labels look alike. In addition to this, both drugs are same schedule and stored next to each other. Oxycodone hydrochloride is a pure opioid agonist relatively selective for the mu receptor, whereas methylphenidate is a CNS stimulant that acts on the brain stem arousal system and cortex. The answer is C. Storage of look-alike medication in fast mover section can lead to the dispensing errors. Here are the common contributing factors and various risk reduction strategies for drug standardizations and storage-related errors. Staff competency and education. It can be important prevention strategy when combined with other strategies that strengthen the medication use system. Before dispensing the high alert medication, the pharmacist must have enough knowledge about dose, indication, and storage of these drugs. Staff education is one of the most important error-preventing strategy. Staff education can effectively augment other error prevention strategies when it is focused on priority topics such as the following. New medication being used in the pharmacy, high alert medication which have the greatest potential to cause patient harm. If an error occurs or drug with unusual or critical dosing considerations. Protocols, policies and procedures related to medication use, including those related to the use of drugs delivery or administration device. Medication errors that have occurred within the organization or occurred in other organization and the error prevention strategies. Case review. An 8-month-old girl was prescribed amoxicillin or clavulanate potassium or augmentin suspension to treat an ear infection. The prescription was taken to the family local community pharmacy where the medication bottle labeled with the instructions to give the child a half teaspoonful of the powder and administered it to the girl. The pharmacy had failed to mix the powder with water prior to dispensing the medication. Patient education. Patient should be advised that medication errors can occur and that they can play a role in preventing these errors. The patient is the final link in the medication use process. As such, an alert and knowledgeable patient can serve as the last line of defense in preventing medication errors. Thus, to prevent error, the patient must receive ongoing education by pharmacist about drug brand and generic name, indication, usual and actual dose, expected and possible adverse effects, drug and food interactions, and how to protect themselves from errors. Here is a tragic event occurred in which a 6-year-old girl died of an accidental overdose of fentanyl. When a child complained of neck pain late on evening, her foster mother gave her an appropriate dose of ibuprofen, but also placed a leftover fentanyl patch on the child's neck to help treat the pain. The next day, the child was found unconscious in bed and was pronounced dead by the time she arrived in the emergency department. The child's foster mother had been given a prescription for fentanyl patches several years earlier to treat chronic pain after an accident. The patch she placed on child was left over from that prescription. On conclusion, medication dispensing is a skillful process, requires adequate knowledge, possible errors, and reduces all those for better patient care. We acknowledge Rajiv Gandhi University of Health Science for their continuous support. Thank you.